We're made to believe that we're invincible, but it's not until you're faced with really difficult times and you realise that life is precious.
Adult male trauma.
He's got a partial degloving of both hands.
St George's, ETA 10 minutes.
He's got head on into a bus.
Almost totally amputated. I'm not joking.
We're always so busy.
Well, they're open 24 hours, 7 days a week.
St George's, London.
Welcome to the madhouse.
One of Britain's busiest A&E departments.
Right, CT are ready.
We need 2 units of O&E now.
OK, this is really time critical. It's our job to look after you and worry about you.
That we're going to find out what's going on with you, OK?
Thank you.
A place where life...
Success.
Love...
She's all right. She's all right.
And loss unfold every single day.
Love you.
Filmed across one 24-hour period, these are the stories of a nation and its health service.
Very beautiful man.
I'll never fully understand how people manage to get through one of the worst things they've ever had to deal with in their life.
God, I can't believe this has happened. So brave, isn't it?
You see people from every single walk of life, and it makes you realise the common threads of humanity far outweigh any differences.
Hello.
Yes, love.
Did you hear me?
No.
I made you tea.
Thank you.
You don't look like you're ill anymore.
I can hold it.
You don't ever make a cup of tea at home. Yes. Is this girl for real? You never make a cup of tea at home. I always make a cup of tea. Tara, no, you don't. Are you joking? Do you want to ring Mum now? I always make tea. Nah, I'm not having it.
Hello, sir. Once again, I'm going to test your swallow. Do it slowly for me.
St George's treats over 1,200 stroke patients every year.
Perfect. You may have a cup of tea. That'd be nice.
Nurse Alison is part of the specialist team responsible for their care.
I don't know many jobs where you can get absolute job satisfaction by placing a pillow in the right position or making someone's mouth look clean. I just wipe your mouth. Well done. And making someone feel comfortable in the bed. Otherwise, are you okay? All right. Caring means everything to me. Oh, bless him, he looks really tired. I had 2 fantastic parents who taught us that people mattered. They both studied medicine, and my father always said, "You're going to be a nurse," because I cared too much about my dolls. He kept on making me little beds for them, and I would be putting bandages and plasters on them. You're in the right place, and we'll give you the right treatment, okay? I enjoy helping other people because my parents showed me how to care. How long have you been here?
My 3rd week.
Excellent, well done. Are you enjoying it?
Yeah.
They cared for other people and they taught us to do the same. Everything's new, isn't it, every day?
Yeah.
It's what being a nurse is all about.
Hello, St George's. Medical or trauma? Yeah. Female thrombolysis call, ETA 5 minutes.
A 77-year-old woman is being rushed to St George's after suffering a suspected stroke.
In stroke patients, time is critical for everything. When the bleep goes off, you drop everything and you run.
Receptionist Teresa's to book in the thrombolysis, thank you.
The woman's husband rang 999 after being woken by his wife.
I realised that something really strange was going on when her movements woke me up, because they'd never happened before. I turned over to see her unable to talk, unable to move her eyes. It was terrifying because I couldn't do anything to help her.
Okay, on 3. Ready? 1, 2, 3. So this is Alex. She's 77. She was up and about walking in her kitchen. Went back to bed just before 6 because she felt tired. And then at 6:10, she woke her husband because she was aware that she'd lost speech, she'd lost the use of her left side. So the onset time is very specific. She's got gross left-sided weakness, slurred speech, and facial droop.
Okay. So I'm going to ask you a few questions. Can you follow my pen to your eyes? Can I get you to lift that arm up in the air for 10 seconds? Are you able to lift it at all? Absolutely dead. How about the leg? Anything at all?
I can feel it, but I can't.
That's okay. Very, very quickly, you can see symptoms of a stroke. Suddenly, the patient, they can't move, they can't talk. And that's the important aspect of stroke, it's sudden. It's like having a car crash in your bed.
Okay. Which day is today? Do you know which day is today?
The patient is having a stroke. Every minute, over 1 million nerve cells will actually be dying. If you don't get that clot removed in the first hours of a stroke, that person, everything about them will change.
We'll take you to the CT scan.
But ultimately, it can be a life or death scenario.
It became scary because I thought, well, I really don't know what's happening. Doesn't happen to yourself, does it? Just happens to others.
We're gonna just do a CT head, okay?
Alex really is the center of the family. We couldn't function without her.
I'll send across your hands, okay? Ready, steady, roll. Alexander, can you try to lift his hand? No? Do you feel?
77-year-old Alex needs an urgent CT scan to determine whether she suffered a stroke after becoming unable to move the left-hand side of her body.
I will say now that actually the left arm there is no response, so it's getting worse. Yeah, it's getting worse.
Breathe in and hold your breath.
One of our first dates I remember, I sold all my university books to take her out to dinner. I had just finished university in Melbourne. And how we met, it sounds a little bit like Casablanca, but it wasn't quite. A good friend, she said, let's go off to this wine bar. And it was a smoky piano-playing wine bar. And there she was across the room. She was very tall, very attractive, and extremely friendly, very easy to talk to. And I was socially awkward, I probably still am, but there was somebody who across the room quite liked me and developed from there. We were together in Australia for, I suppose it was about a year. Then I got a job in London. Alex joined me. She had friends here, and we decided to get married. We had this full service and full reception, thanks to all these good friends of hers. That was 1972. We went on a honeymoon on mobilettes. They were bicycles with motors, and we went round a bit of northern Italy on those for 3 weeks. I remember she was self-confident, independent. That's her nature. That was really the draw, I suppose. So that led to me thinking we would be really good together for a long time. And we were.
I'm really hungry this morning.
I'm just thinking exactly the same.
I'm really hungry. I haven't really got breakfast though.
I need some food, so this is going to suffice.
I've just got cereal. I might nick some of Tara's cornflakes.
66-year-old Stephen has come to St George's with severe stomach cramps.
I was never a confirmed bachelor at all. I thought I was going to be married at 25. It's just, it hasn't really happened. I find when girls know I like railways, and I get a kick from watching freight trains go up the incline to Wandsworth Road Station, their eyes glaze over. You know, they imagine I have a duffel coat, you know, I eat pork pies. Yes. And I reach the heights of ecstasy, you know, when the class 442 EMU goes by. Hello.
How are you today?
Not so bad. Nice to meet you.
Nice to meet you.
I always shake hands, and I've never known whether I should do, or do you have to wash them straight away? You keep washing them.
We can do both, eh? So what was the problem today?
Basically, I just got gripe here. It was going in waves, you see, and I couldn't get comfortable. If I lay on the bed, I felt better for 20 seconds, and it felt worse again. A couple of times I was nearly passing out, really. You know, I mean, we were in absolute agony.
Right, I'm going to have a look at you, if that's OK.
Oh.
Can you hop onto the bed?
Yeah.
Are you comfortable doing that?
Yeah, I just feel a little bit,
Yeah,
you know.
a bit,
Yeah, as if there's something going on inside. I was born in '52, and I've lived in the same house all my life.
Can you sit forward?
Yeah, all. We had got the railway butting on to the house at Clapham Junction Station. I remember being in a high chair. That's when my parents put me at the window to look at all the trains going by in and out of Clapham Junction. I did have an exciting childhood, and I always got on well with my dad. We used to go on these motorbike trips, going down old railway cuttings and looking at old tunnels.
Lie back on the bed.
Lovely. In those days, we weren't poverty-stricken, but everyone was in the same boat, so it was just normal. It was all working class here. We had great camaraderie here. You know, I might say to Mum, oh, I've been in number 19. They gave me some jelly. You know, we were just in and out of other people's houses. It was, you know, we all played in the street. Good old days. But we had problems. Unfortunately, it wasn't all peaches and cream.
It feels and sounds OK. Let me have a look at your blood test. It might give me a bit of a clue. I'll be back in 5 minutes.
Thank you. Yeah, lovely. Thank you.
Could Dr. Nick please contact resus?
Could someone please come deal with my finger? I'm going to pass out.
You're so wimp. Your finger looks a bit swollen, actually.
I think it is swollen.
16-year-old Aaliyah has come to A&E with her mum Maria and older sister Tia after injuring her fingernail in a fight at school.
Is it still throbbing?
Yeah. So basically, when we go on holiday, you're just going to have one finger missing.
Is that funny?
Yeah, it's funny.
Me and my sister, 1 minute we're friends, next minute we're fighting and arguing. Because she's irritating, I irritate her. I find it funny.
I knew your nail was going to get broken, you know, I swear.
You knew her nail was going to get broken?
So this is your doing?
No, it's just the simple fact that, like, she got them done, what, yesterday? It's like, it was just inevitable.
And I thought they were so nice.
Me and Aaliyah, yeah, we're very close. It's kind of like having a twin. We argue, we fight, like, every day, but it'll be fine because in like an hour or two later, she'll be showing me something on Instagram, or I'll be messaging her saying, tell her to do my lashes or something.
Oh, you're not going to be a baby? And you're not having magic cream? My girls have their moments and their comments and their arguments, but most of the time, yeah, they're there for each other, which is what sisters is about, really, isn't it?
Aaliyah!
Come on, then.
Hi, come through. Come through here. Hi, hi. Have a seat here. My name's Tamsin, I'm one of the doctors.
Hello.
Who am I seeing? Oh, hello.
Hi.
Good to hear. Right, so what's happened to you? What's brought you in here?
My nail.
Your nail?
Yeah.
Oh. Oh, how did you do that?
In a fight.
In a fight?
Yeah.
Oh dear. So, yes, well, we're going to probably have to take that nail off.
How?
Well, it's half coming off already, you see. So what we need to do, they're very nice. Do you have these done at the nail parlour?
Yeah.
Yeah? So you're going to have no nail for a little while, unfortunately. They're very strong, aren't they? And they're
Aaliyah, she loves the physical side of things. She loves football. She was a goalkeeper. Aaliyah actually got the Golden Glove because she only let in 15 goals all season. And it would have been 14, but she deliberately let a goal in because this team had never scored a goal. And I said, well, why did you do that? You spoilt your record. She went, oh, Mum, but did you see their faces?
So we're going to have to put a little local anaesthetic in here to block it. A little bit painful putting the block in.
Oh, I can't have the magic cream?
No, we're not waiting on magic cream. She is a bit like that, you know, if she thinks someone's being picked on or she don't like that sort of thing, she will stand up for the others. She has taken that from both me and her dad.
It goes all numb, and then we take the nail off, OK?
Yeah.
And then a new one can grow underneath from there.
Is it painful for the new one to grow through?
Not really painful for the new one to come through, but it'll be a little bit painful putting the block in.
All my girls will stand up for themselves. Having that type of attitude has probably helped them with certain situations.
I'm just going to go and get equipment and we'll set you up here, OK? You can sit up here on the bed.
Unfortunately, I've been called all kinds of names in the past. Unless you're actually involved in it, you don't understand the sort of racism that you face.
Great, I'll be back in a minute.
Hello.
Hi, I'm Alina, one of the junior doctors. Just wanted to give you an update of what's happening. Okay, we did a scan of her head. Now we are discussing with the radiologist that we have to do more investigations.
No, I understand.
The stroke team need to determine whether Alex's symptoms have been caused by a bleed or a clot in her brain before they decide on the next stage of her treatment.
I think you'll be okay to come and see her.
Okay, good.
Her husband Paul has been waiting to see her.
Thank you. Hello. Yep.
Don't worry.
Sorry. What for? It's not your fault. I was a civil engineer. I got a contract for design of the University of Tripoli in Libya. We went there in 1974. We had Matthew, first baby, by then. There was a house to go to. There was a car. Everything was provided. In that regard, the expat life was privileged. Many of the cafes, many of the restaurants in the central Tripoli were very enjoyable. But Libya felt quite tense at times.
X-ray basic.
It was an Islamic state. Gaddafi had been there for, I think, 5 years. He wanted greater adherence to the teachings of the Quran. There was lots of spying, I suppose, going on, both on Libyans and on foreigners. They worried about the role of women.
Giving people lots of shots.
No, enough. For Alex, it was tough. You're expected to dress modestly and not upset the men, because it was male-driven, still is. For Alex, there was very little contact directly with Libyan women because they were largely housebound. Feeling isolated, it became quite difficult for her, especially with an incredibly young child.
I think we need to. Thrombolyse her anyway.
Scan results show that Alex has suffered a stroke caused by a blood clot.
Hello.
Hello, and I'm one of the stroke doctors.
I'm
So
Paul.
we now know that your wife's had a stroke.
Yep.
Obviously, as we know, there's a very, very profound weakness
Surely.
on the left-hand side. That there's a treatment called thrombolysis,
Yes.
which, when given soon after a stroke,
Yes.
can unblock the artery.
Thrombolysis is a clot-busting drug. Without it, you're going to have permanent damage. Lack of power in a limb, lack of speech, lack of vision. The quicker we're going to dissolve that clot, the quicker the brain will recover.
There are risks in this treatment. In about 1 in 100 cases, there is a more catastrophic bleed in the head, and we make it a lot worse. But we think that it's worth taking the risk.
Sure.
But it doesn't always work effectively for everyone. So this drug I'm going to give very slowly. It can kill.
Okay, so, sorry about that. Just got my trolley ready.
Doctors are preparing to surgically remove 16-year-old Aaliyah's fingernail.
Right.
I'd say not to drill it off.
No, we kind of just pull it. Yeah. I'm just going to put a little block in, okay? Be brave and keep still.
I met their dad when I was 19. He'd not long come from Jamaica. He was cute, but Tony was so quiet and shy at the time. He wanted to ask me to dance, but he didn't have the nerve. We were together 23 years.
It says little, but the needle looks very big.
It's very small and thin, though, okay?
We actually became better friends when we separated. But when it came to the girls, he was still a great dad. He really was.
When I was young, the room could be like boring and dull, and then he would come in and just make a joke and everyone would start laughing. He was just one of them guys that you just want to be friends with. Like, you just wanted to be around him all the time. There was one time he took us to the park and he spun us around on one of those things that you stand up on, and it's like a spinning wheel, and me and my sister both came off it and was both sick. It was so funny. It was funny. We were sick and then he felt bad and brought us McDonald's after. We was a close family. My mum and dad taught us to be strong.
But it does sting a little bit, so look, put your hand here, okay?
We've had tough times. I don't think it's ever really acceptable being different. When I had my first daughter 35 years ago, having a mixed-race child, it was difficult. The way people were looking at the buggy, it did really agitate me.
Right, okay, very good.
Is it any different to now? It's just a different way of doing it. They don't actually name call now, but I think mixed race children still find it hard. Both black and white people have an issue with it.
Do you fight often?
No. My primary school was quite mixed, but as I got older, especially the school that I went to is a predominantly black school. Literally, there was 2 mixed race girls in my class, me and another girl. A girl told me one time that she didn't want me to come to her birthday because all of the boys are going to be looking at me instead of her.
I guess there's still stuff with girls when you're a lighter complexion. It's, oh, she thinks she's too nice. I just kind of block it out. It's something I got from my dad.
He always said some people might struggle to deal with certain people from certain backgrounds or statuses, but it'll be fine because we've got each other.
Does it feel a bit tingly? No?
No, I can feel it like getting bigger.
Their dad, he was always protective over the girls. He installed in them there's more to the person than just what you see.
Okay, I'll give you 5-10 minutes, all right, just to let it work. Is that all right?
Yep.
I suppose I still find it hard to believe that he's not here.
Okay, be back in a minute.
I saw your flossing.
Let me see it, Jules.
Oh, I can't.
Hang on.
No, because I did it the other day at home. It was awful.
And Nathan sort of said you go like that. And then I get confused on going to the other side.
How to do the floss dance, a parent's guide.
Oh, perfect.
I don't think this is it. David, you do it. Can you do it? Come on, get involved. Come on, do it, David.
Place it like this, and then like this.
I'm getting a stitch. I don't think it's a dance for the elderly.
Da, da, dee, 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 dee. Oh yeah, here we are.
The medical team have taken an initial sample of Stephen's blood to determine what may be causing his stomach pain.
What is it?
My name is Grace, I'm one of the nurses.
Yes, yeah. I nearly lay down on the bed, but then I thought I've got to take my shoes off.
Just get a set of ops. Have you had anything for your pain?
Oh, heck yeah, everything.
In the house? Oh,
Yeah.
Good.
When I was 7 years old, my parents were getting very worried about me because I wasn't putting on any weight. In desperation one day, my mum took me to my GP and he said there's outbreaks of tuberculosis in the neighbourhood, and I got tested and I had it. So I was in hospital straight away. I always remember it, no ambulance. I was driven in a doctor's car. He was making a trip. So I was in an old Ford Pilot car, as I remember, and I was in hospital November 59 until April 1960.
Okay, the blood pressure is a bit on the low side. Is it normally like that?
Yes. I had to suffer 3 injections a day. I mean, I was bedbound for 2 months. They didn't allow you to move. I had to learn to walk again. My legs and knees had given up. So I really missed Mum and Dad. They were allowed to come, but it was a half-hour day, very strict visiting hours. It could be lonely.
Okay.
It was quite traumatic because I was only 7 years old. Hello.
So that's your kind of hobby, trains on the side.
Yeah, well, I've got loads of hobbies.
Yeah.
Planetary. I've got loads of books on Pluto at the moment.
On Pluto? Yeah.
The spacecraft went by on July 2014. I've got loads of interest: politics, finance. I'm never bored.
That's great.
You know, listening to classical music, but I listen to all types of music actually. Grunge, garage. You know. Dance.
Yeah, a bit of everything.
Oh, what are you testing me now for?
So I just want to I need to look at the blood in your artery just to look at your kind of acid levels.
Oh.
Okay. So I just need the underside.
Oh, you did say underside, didn't you? Tuberculosis affected me quite deeply. My schooling suffered. And when I was 18, I was struggling to do all these A-level studies.
Yeah, come on, get in.
I know, we'll get it, don't worry.
So I just made an impromptu decision. Left school lunchtime, went into the local bank and said, Boulders Brass, I want to work for Westminster Bank.
Let's have a look on this side.
Funnily enough, they said, basically start work Monday in Hammersmith. I didn't even have a suit. At the time, I just wanted money. That's being completely honest. I just wanted some dosh. The 1980s, it was a crazy period for me. In the city, it was very much lunchtime drinking was looked on as a norm. And if you didn't go lunchtime drinking, what's wrong with you? That's about my only time I mixed with the sort of high flyers, you know, loads of money brigade. I'd probably still be working now if it wasn't for my dad.
We're not 100% sure what's going on. But our biggest worry is that sometimes if the blood supply to your colon gets a little bit obstructed, it can cause this sudden onset pain and need to open
Yes, because it can be serious, can't it?
It can be, yeah. Let me run this and I'll be back, okay?
Thank you.
People's pain boundaries are different. Mine is very high. Very high. Oh,
Very
really?
low.
Exactly.
Aaliyah has been given a local anaesthetic and is waiting for Dr. Tamsin to remove her fingernail.
Okay. How does that feel? Is it gone numb?
Yep.
Brilliant. So let's give it a little clean. Help when I do that.
No.
So look, you practically look at that.
I know.
You practically pulled it off yourself. Look how wibbly that is.
Oh.
When their dad, Tony, got ill, it was really, really sudden. It was Boxing Day. He'd had this fit, you know, this massive fit. And he went to the doctors and they found out he'd got brain tumours and lung cancer. Right, I shall just do the other bit of the corner, yeah?
I didn't really take in consideration that, like, what it meant. I kind of just thought, oh, I'd be fine, the doctors would deal with it.
He spent a lot of time in hospital, to be honest. I used to go from school to the hospital. I would spend time with him, do my homework and some revision there. He did used to help me revise, actually.
We always have to go up there and bring him food because he refused to eat hospital food. Never eat hospital food.
Is that okay? You're not feeling anything?
Oh, okay.
I was upstairs getting ready, making Snapchats and everything, about to go to the hospital. And then my big sister called and said that he's having difficulty breathing and stuff and that we should go to the hospital, so we all rushed there. But by the time we got there, it died. It's like 1 minute somebody's there, then they're just gone.
Ah, there we are.
Oh, brave girl, Lee.
It was hard. Like, I didn't think that, like, he would ever pass.
Now I'm going to put a little dressing on it, okay?
It was a big funeral. He was taken and carried in by 2 white horses. Me and my sisters, we all wore white and everybody else wore black.
Yeah, I think our bonds got stronger. But everything that we've been through, we've looked after each other more. I think it's brought us way more closer.
So that should be okay.
I guess we just needed to be there for each other more and then, like, be there to support my mum also.
It was tough. But they've been very supportive. But it's nice that they have that closeness. It's always nice to know that your family were there beside you. Well done, you did very well. Didn't even flinch. Bravely. I know their dad. He was proud of the girls. Oh, and you wanted your nail, didn't you?
Oh, yes, please.
Souvenir.
There you are.
Okay.
Thank you.
He always will be the part of them, no matter what. Okay, bye-bye.
Bye.
See you.
Dad. Lips look really dry. Okay. There you go. Pucker. Go rub it. Oh my gosh, you're too funny.
Alex, so this drug's almost finished. All right. So the treatment is almost done.
The clot-busting drug is beginning to reverse the symptoms of Alex's stroke, but doctors are still concerned about potentially life-threatening side effects.
The drug that we've given you, obviously you know there's obviously complications of bleeding, and that's what we're looking for.
Right.
So we're not expecting it, but we just want to make sure that you're okay. And so at the moment you're going to be looked at every 15 minutes, but we'll try and make times we're monitoring it as short as possible. All right?
Right, take a seat down. I will.
After a few years in Libya, we decided it's time to do something else. So back to the company. What do you got for me? And it was a job in the middle of Zambia. And then Emily came along, and our need to have somewhere more settled took charge. They didn't need to be expatriates. They needed to have a stable home. So we came back to London to make our life here.
Did it take me very long to respond to you?
I'm helping you out of bed.
No, I was trying to help you sit up, and then I saw your tongue.
Oh, wonderful.
It was a bit floppy.
Not so like now.
Perfect.
All right.
We've been in this house now since 1981. The roots are here. For our grandchildren, the roots are here. But my ideas of home are more to do with people rather than places. Alex, for me, she is definitely home. She is the essence of my happiness. I still tell her that I love her.
Oh, it's getting late, you see. I was rather home.
Stephen is awaiting the results of a second blood test to determine the cause of his stomach pain.
Hi there.
Doctors here.
Oh, nice to meet you.
Do you mind if I...
No, not at all.
Tummy, so
No, not at all.
Just head down.
Oh.
I lived with my mum and dad all my life. And I was working in the city when my mum's diagnosed with Alzheimer's. Back then, my dad was caring for my mum. She died in 2004. I still miss her a lot. Then my dad was diagnosed with the same thing. I resigned to basically look after him. Alzheimer's is well, it's not a polite word to say, so I won't say any word, but Alzheimer's is an absolute bummer. It was stressful. And I'd be lying if I said I always felt, what a privilege to do this for Dad. It was tough because I like gallivanting around. I like being a free spirit. But you just got to care for your dad, haven't you? Because my dad would do all this for me,
So there might be a infection of your tummy or intestine.
So I go back to GP.
That should pass on its own. So what we'll do is give you something called codiadromol, which is a painkiller.
Lovely. Thank you, Doc.
Not at all.
Thank you.
Dad steadily declined. So he passed away just 1st of June this year. It's really very mixed emotions. I miss him, but I've got my life back. I felt when my dad passes on and my mum, I'd sort of actively seek someone. If I met a girl who was really into railways big time, you know, and would go up to Glasgow to go on the Glasgow subway and go to Edinburgh to go on the tramway, that would be really great. So now I'm 66. I'm a bit of an old codger, but, you know, I'm not bad for my age. I'm optimistic. I'm optimistic.
So can you leave your left arm up? Is it getting better?
Yeah.
Okay. Squeeze my hand. Well done.
Alex arrived in resus 3.5 hours ago, unable to move her left arm or leg after suffering a stroke.
Hello. My bed's going to be a little while. I'm sorry. As soon as I can, I will send down a message to let you know to come up to the ward. Is that okay?
Will I be able to come back in later on?
Yes, of course you can.
Okay.
We're not going to exclude you from anything.
Hammer on the door.
I wouldn't say the hammer. There's a buzzer, so just buzzer.
All right.
Okay, I'll see you later. I think that throughout my nursing career, I've realised how important relatives are. Having someone that actually, who knows you, who cares for you, close, holding a hand, can actually make a difference. Can help someone recover.
Come here, Bob.
Come here.
Hello.
Hello. Sweetheart. Hello, baby. Hello, baby. She's a bit scared. Mwah.
It's a bit strange.
Nana, she's in the bed.
Hello.
Where's she in the bed?
I had personal experience of it. My father, he died very young. I was 7 when he had his first heart attack. And I always remember I went to see him in Kingston Hospital, and this nurse said, "You can't come in." It was horrendous. My father and I, we were devastated.
Can you wiggle your toes, Mum?
You know, can move the leg. I couldn't do that before. It's amazing, miracle drug.
It shaped me in lots of ways. Years later, it made me realise that the patient's family is exceptionally important. It's something that has always been part of my sort of mantra. My aim is to make sure that the relatives feel involved all the time.
Hello, madam.
Hello, how are you? It's good.
Family is central to everything. They're part of the person. That's how we look after stroke patients.
Got a lady friend, we're just best friends, you know, I like her a lot. We just go for afternoon tea. How that will pan out, I do not know. You just have to hope for the best in life, don't you, really?
Clearly it's had an effect on her. Sort of, I'm more watchful over her. and the amount of things that she does than perhaps I used to be.
A long haul is what I thought was going to be a very long haul. Really, I am amazed how well I've done. It does make you feel that time is very precious.
We want to see places that we've never seen before, and we have decided to make the best of something horrible happening.